Pressure ulcers are one of the most preventable complications in hospitalized and bedridden patients, yet still causes immense suffering and healthcare costs worldwide. Let us see how to choose the right dressing for different types of pressure ulcers. Pressure ulcer happens because of the localized injuries to skin and underlying tissue, usually over the bony prominences. They are also called decubitus ulcers or bed sores. They develop due to sustained pressure, friction, or shear forces. Something as simple as lying in one position for too long can start this cascade. So, what are the classical hot spots for developing these ulcers? Starting from sacrum, heels, trochanter, ischium, occiput. As shown in the image below, so with different types of position, the classical hotspots may vary. Clinically, we classify them into four stages. Stage 1 is non-blanchable erythema. Stage 2, partial thickness loss of skin. Stage 3 is full thickness loss extending into subcutaneous tissue. Stage 4, full thickness tissue loss with exposed bone or muscle. And once a pressure ulcer develops, it can be a major setback in recovery. How do we identify who is at risk before the ulcer even develops? So that is where the Braden scale comes in. It looks at 6 factors like sensory perception, moisture, activity, mobility, nutrition and friction and shear. The scores ranges from 6 to anything less than 12, the patient is at very high risk. So between 15 to 18, the risk is mild, 13 to 14, the risk is moderate. There are various methods we follow to prevent these pressure ulcers like frequent positioning of the patient, water bed mattress, alpha bed mattress, etc. This is one of the position that is 30-degree slide tilt in which the patient lies very comfortably instead of the right lateral position. Nowadays people are preferring this position for turning the patient because it avoids ulceration in the trochanter. Now let's talk about the heart of wound management, that is dressings. Here is the golden rule: moist wound dressing is better than dry wound dressing. So there are different types of dressing categories are available, starting from transparent film, hydrogels, hydrocolloids, alginates, foams, hydrofibers, antimicrobial dressings, gauze and roller. So these dressing categories are not only for pressure ulcers, they can be used in other types of ulcers also. The art is in matching the right dressing to the wound type and stage. First is the transparent films. They contain polyurethane. They are semi-permeable to oxygen and water vapor, impermeable to bacteria. So these transparent films are helpful in stage 1 pressure ulcers where the skin is intact with erythema. The advantage is it allows visual monitoring of the wound. We have to avoid it in moderate to heavy exudate and infected wounds. The examples are Opsite and Tegaderm. So these are all brand names. Next is hydrogel dressings. They contain water or glycerin based gels. So their function is to donate moisture and promote autolytic debridement. Indications: minimally exudating pressure ulcers, that is grade 2 with minimal exudating wounds. Avoid in heavily exudative wounds or infected wounds. So examples are intrasite gel, solosite gel, aqua gel and purilon gel. The next category is hydrocolloid dressings. They are gel forming agents containing carboxymethyl cellulose, gelatin and pectin, and their function is to promote autolysis and they are waterproof. Indications: low to moderate exudating pressure ulcers, granulating wounds and sloughy wounds. So we have to avoid it in infected wounds, heavy exudating wounds and deep cavities. So the examples are duodenum, Comfil and Tegasap. Next category is hydrofiber dressings. So they contain carboxymethyl cellulose fibers and the indication is moderate to heavy exudating ulcers and cavity wounds. Cavity wounds means so wounds with so much of dead space inside the wound. Examples: Aquagel and Durafiber. The next one is foam dressings. They contain polyurethane. Their function is to absorb exudate, cushion the wound and maintain moist environment. Indication is moderate to heavily exudating pressure ulcers and this provides cushion effect on the pressure points. Avoid it in dry and necrotic wounds. Examples are Mepilex, Teal, Alivine, etc. Next comes the alginate dressings. Alginate dressings contain seaweed derived calcium or sodium alginate fibers. They are highly absorbent. The very important point to note is they are good for bleeding wounds. So they are hemostatic. Indications: deep cavity wounds with copious drainage. We have to always cover this alginate dressings with a secondary dressing, that is gauze. Avoid this in dry or minimally exudating ulcers. Then we have antimicrobial dressings. Here, dressings are impregnated with silver, iodine, honey, or PHMB. PHMB is polyhexamethylene biguanide. It is a broad spectrum antimicrobial agent. The function of antimicrobial dressings is to reduce the bioburden and control infections. Indications: infected or critically colonized pressure ulcers and malodorous wounds. Examples are Acticot, that is impregnated with silver, Iodosorb, Iodoflex, that is impregnated with iodine, Medihoney, and finally we have the plain gauze and roller dressings. So this is used in resource limited setup where most of the other dressing materials are not available. So saline soaked gauze can be used in all stages of ulcer, but there are many limitations to it. Gauze is non-occlusive, so the wound is dried out very frequently and the healing is also slower. Frequent changes in dressing makes the patient uncomfortable because of pain and less effective in maintaining moist wound healing. Frequency of change, so for gauze and roll, we need to change every 24 hours if it is stage 1 or 2. If it is stage 3 to 4 with a moderate to heavy exudate, we have to change the dressings very frequently, either 2 times a day to maximum 3 times a day, depending upon the amount of fluid collected in the dressing material. At a glance, if the ulcer is dry, use hydrogel. So hydrogel will hydrate and soften. If you have a low exudate, use hydrocolloid. So this will seal and stick. With moderate to heavy exudates, either you can choose foam, alginate, or hydrofiber. So foam, they will provide a cushion effect and protect the ulcer. Alginates, they absorb so much of exudates from the wound and they stop the bleeding. Hydrofiber, they absorb excess fluid from the wound, they soak, and with the help of soakage, they lock the wound. Infected ulcer, choose an antimicrobial dressing, so they will fight and heal. Stage 1 intact skin, so choose a transparent film so we can cover and see the ulcer. Roll and gauze, pack and wrap, we can use it in all stages, but there are many limitations. So this is a summary table with all the comparisons given, brand names, indications, where to use, where to avoid, and in which stages of pressure ulcer these are suitable I have given. So you can go through it. Thanks for watching. Subscribe to our channels for more contents.